Hi, I'm Sreesha Vishwam, Senior Embryologist and Lab Supervisor, Kraft Hospital and Research Center, Kodungalur. I'm here to talk to you on embryo freezing. Embryo freezing is a procedure which is done to preserve your embryos for a future use. This is a technique through which your embryos are taken to a very low temperature of minus 196 degrees Celsius in liquid nitrogen. At this stage, the growth of your embryo will be temporarily stopped and you can store the embryo for a long period of time. When the patient is ready for frozen embryo transfer, you can thaw these embryos. Thawing means taking the embryos to a normal temperature of 37 degrees Celsius from this minus 196 degrees Celsius. This procedure is known as embryo thawing or embryo warming. The temporarily stopped growth and development of the embryo is regained once when it reaches to the 37 degrees Celsius from this minus 196 degrees Celsius. Now, embryo freezing is done on specific assigned devices called cryologs or cryotops. The number of cryologs to be used for a particular patient is strictly depending upon the embryo quality and clinical history of the patient. According to the embryo quality and clinical history of the patient, the embryologist will decide how many cryologs to be taken for a particular patient. For example, if a patient has 8 embryos, for some of them, the 8 embryos will be frozen in 2 different cryologs, and for some of them, the 8 embryos will be frozen in 3 different cryologs as 2, 3 and 3. Usually on day 3 following ICSI, according to the embryo quality and clinical history of the patient will be chosen either for a fresh embryo transfer or for an all-freeze cycle by embryologist and clinician. Embryo freezing mainly we are doing in 2 different scenarios. The first one is if a patient has remaining embryos after their embryo transfer, they can go for the excess embryo freezing. This excess frozen embryo they can use for a future second or third embryo transfer. So this is the first scenario, and in the second scenario, if the patient is not ready for a fresh embryo transfer in the current aspiration cycle, for example, their uterine wall thickness is not optimal for a transfer, or their hormonal parameters are not optimal for a present transfer, they can go for an all embryo freeze cycle. Later, when the patient is ready for a frozen embryo transfer, maybe after 2 or 3 months, the patient can come and do a frozen embryo transfer. And as a third scenario, if a patient is undergoing frozen embryo transfer, 3 embryos are taken for a particular patient and we have transferred only 2 embryos, the remaining embryos, if they are developing or progressing well in culture, they can go for a refreeze cycle. The patient's embryo can be refrozen and can be used again in future for another transfer. Hope you have got an idea about embryo freezing. Thank you so much for watching.
Kraft Fertility Center, caring couples.